We have a lot of people studying public health. The enrollment in public health schools has gone up dramatically. There's a lot of undergraduates studying public health. And on the opposite side here, you have so many, in terms of who can hire them, you have, the degrees in public health historically, if you go back in history, they were designed to prepare people to work in the government health departments. That was the reason they exist. But these days, an epidemiology grad can get a really cool job at Fitbit. You know what I'm saying? Like Google, doing data analytics, data science, health education students can get a really cool job at a healthcare marketing company making ads for Lipitor or something like that.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 91. Hi everyone, Omari Richards here. Thank you all so much for tuning in today. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe if you have not as yet. Leave a review, leave a 5-star review if you have not. I know people on Spotify, you've been able to leave a review, so I greatly appreciate if you do that. It helps the show out a lot. And be sure to share with a friend. There's a lot of great insights in these shows, and it's great to just share with other people so that they can learn and benefit from it as well as they navigate their public health careers. Really enjoyed today's episode. I know you all are going to get a lot of great insights from this. I would definitely take some notes because there was some great advice around building out your resume, as well as some introspective coaching on yourself from a career coach that has helped many, many students. So be sure to listen to this, maybe listen to it twice, enjoy. Today, we have someone who helps people get jobs that matter as a career coach, as well as being the Assistant Dean of Career Services at Columbia University School of Public Health. You may know her from being a co-author on the book 101 Plus Careers in Public Health, the third edition, or the ones before that. She got her bachelor's degree in anthropology at the University of Michigan. She has a master's of science in nonprofit management / organizational development from the New School University, and a master of education in counselor education, as well as her master's of education in adult learning and leadership from Teachers College of Columbia University. Lastly, she recently completed her PhD in public health at Maastricht University. We have Dr. Heather Krasna, PhD, MS, EdM. Welcome to the show.
Thank you so much. It's a pleasure to be here today.
Yeah. I'm really glad to reconnect. I know you reached out about being on the book, which I'm very honored and privileged to be on. And I know you have tons of public health information, and your story is going to be very useful. So I'm glad to have you on.
Thank you.
You're most welcome. So how are you doing, and how have you been coping during this pandemic time?
Things are fine in a strange way, I guess. I'm here in New York City, and we have been through a lot of really difficult times with COVID. And I guess those folks who are surrounded by public health experts, I guess some of those experts could have potentially seen this coming. Some people say, oh, we never could have predicted it, but I actually know a few people who might have predicted all of this happening. But I guess no one thought maybe it would last as long as it has. But I will say the plus side in a strange way is that now there's a lot more interest in public health, and a lot of people who are passionate about this field, and a lot of people looking to study public health. So I like to be optimistic and think there's some opportunities to reinvigorate our whole public health workforce and get people more passionate about this field for tragic reasons. But at least, there is that silver lining, I guess, that people now at least have heard of public health and may be interested in it. So, yeah.
That is so true, and that I think it has brought out public health and put it into the forefront of people actually know what public health is. If you ask anyone 3 years ago what public health was, they probably had no clue. But now people know more about that, and that has translated into more students being interested in public health. And hopefully, as you said, we do get a lot of the changes in public health that we need to get that sustainable and just get communities better and have healthy a healthier society as a whole. So I appreciate that. So how do you identify, and then tell us a little bit about your personal background?
Yeah, sure. So I'm a cisgender white woman. I use she, her pronouns. And I grew up in the Midwest in Michigan. My parents were both college professors. So I spent most of my career in higher education. And it's sort of like very natural to me, that universe of academia, because of that. Yeah, that's just a quick little intro of my background. Mm-hmm.
Okay, I appreciate that. And were your parents driving you to go and get education and just continue to educate yourself? Is that a theme that you remember from growing up?
For sure, yes. And absolutely, there was an assumption that I would definitely go to college, first of all. Maybe there wasn't an assumption that I would go and get a PhD, but definitely the value of education was very important in my family, and probably maybe in a strange way might have been a little too important, where like the grades were, there was a lot of really pressure to have really good grades, and that was the strongest emphasis. But I think it was good. I think I was probably nerdy as a high school student among my friends, like the person who really liked to take all the advanced classes and everything. But it also gave me a lot of privileges I think made it much easier for me to succeed in school because of my parents, having a lot of education, like they knew how the system worked, and gave me a lot of support and everything. So definitely it was a huge benefit to me to have that kind of background. But I've also learned about my own, I've reflected a lot on that background, and I know that many people have many more hurdles to achieving higher education. And so one of my passions is helping individuals who might be the first fit in their family to go to college, and especially those who are navigating all the higher ed universe, because it's kind of like a foreign planet in some strange way. Like there's a lot of, it's got its own culture in it. And so helping people navigate that is one of the things I really like to do as much as I can. So. Mm-hmm.
Awesome. And I'll get back to a question on that specifically a little bit later on. And before we hop into your story, what does public health mean to you?
It's a really great question. I would just say that there's a lot of really interesting definitions about public health that I've heard. One of the ones that jumps out at me is one that someone recently wrote about, which is the efforts to improve the health of nobody in particular. I thought that was where it's not like the health of this person, that person, and the next person. It's just all people. That's what public health is in some ways. So what does it mean to me? I mean, I would say that in some ways, I've always been really excited about public service and people trying to make the world a better place. And I feel like public health is one of the kind of backbones of all of that. It kind of encompasses so many different things. When you think about all the factors that helped a community to be healthy, it just hits everything. Public health goes into so many different directions. So what does it mean to me? I mean, at the end of the day, having solid public health infrastructure and programs and even just an understanding about public health is what I would say distinguishes, a good organization, a good country even, right? If you won't bother to even invest in the public health services, then what does that say about how you value people in your community or in your state or your country? So to me, it's about the radical idea that every person should have the right to be healthy. And it shouldn't be a radical idea And yet it really is, when you stop and think about, like, what does it involve to support every person, whoever they may be, wherever they live, whatever their zip code, whatever, that they have the same right as every other person to have the same level of health. It's a very radical idea, at least sometimes in the United States. I think it's a profound thought. So that's what I think it means to me, is that idea that everybody has the same right to be, healthy and vibrant and to make the most of their lives. So that's how I would think of it.
I love that. I love the beginning definition, then going back to your definition. And I think it is a radical thing, especially just because the systems have been set up in the way to hold back and oppress certain communities and not give them the same access and opportunities. So yeah, and I hope, as you said, and as we said earlier, I hope that the pandemic and the light on public health gets us to really rethink how we're doing things and be more impactful on a larger scale. Okay, so you went on from being a nerdy high schooler into getting your bachelor's degree in anthropology at the University of Michigan. So tell me about that thought process for you.
That was a very default decision. So I work with a lot of people who are in the middle of like a difficult life decision, because as a career coach, that's why people are reaching out to you, right? They are looking for a new job, or they're looking for a promotion, or they don't know what to do with their life. And they're intentionally pausing and saying, gosh, there's 17 things I could do. Which one is the right one for me? And then there's times in life where you just do step one foot in front of the other. And that's kind of what I would say about my undergraduate school, is that, I had a couple of other options of places that I could go. And the University of Michigan made the most sense for me for a number of reasons. So I grew up in Michigan. And so, to be really honest, like, the in-state tuition was a major factor because not having to take out a ton of student loans, because I had that lower tuition and certain kinds of scholarships because I could go there. That made it kind of the most obvious choice. It's a huge university, the University of Michigan. And I would say, like, whole chunks of the culture of U of M are not, like, there's a lot about football and fraternities and sororities, and just that had no interest for me at all, to be honest. Very minimal, let's just say very minimal interest. But I did think I kind of found my niche there. And picking anthropology was also like kind of another one of those things that just it became clear which major made sense for me. And that was because, to be, again, pragmatic reasons. And it's kind of funny now that I went on and had to study what I've studied since then. But like, I had a choice. I was thinking psychology, sociology, religious studies, maybe, or anthropology, or I like music. So I was thinking maybe something with that. And I was like, well, if I have to do sociology or psychology, I'm going to have to take a statistics class. And, I took calculus as a high school student, everything. I could probably do it, but I just didn't want to do any, I just was not interested in it, So I was like, well, in anthropology, you don't have to take statistics. I'm going to do that instead. So it was one of those really kind of silly choices, but it was the right choice because I also had the privilege of picking the classes that I thought were really interesting. And it just turned out that, like, a lot of those were anthropology classes, and partly because it's very big picture. You're looking at culture, you're looking at, human history, you're looking at linguistics and religion and human evolution and all these things. And all those topics were really interesting. So it just presented itself. So I would say it wasn't like the world's most tough choice back at that time. It was like just laid out kind of. So that's kind of how that went for me. Mm-hmm.
Yeah, and I think that's absolutely fair. Those are fair reasons for choosing the school, and I completely understand I wanted to take the statistics class and go in the anthropology route. So during your undergrad, did you know like what you were thinking of doing afterwards? Was it that you knew that you were going to go to graduate school? Do you know you were trying to work in a certain like field, or what was the thought process?
Well, I'm kind of laughing because it's super ironic about what I now do for a living and what I've been doing for 23 years or so, because I was exactly one of those undergrads who just like did not know how to find employment. It literally had no idea. And I used my career center at the University of Michigan, I think twice in 4 years. So again, like I have a lot of empathy for students who are discerning what they want to do with their life, because I was totally one of those students and I really didn't take advantage of the career center. But if anything, I did have a very strong, like, public service motivation is what there's actually a term for that. Public service motivation is like a specific kind of technical term. I didn't know it at the time, but that's what I had. I had a desire to make the world a better place. And so, and I had that desire way from before college. Like I had in high school, I started an environmental student group and we started our first recycling program, which didn't exist at my high school. You know, so all through college, I was also involved with, you know, student leadership and things like that, different kinds of internships and activities. And I didn't really know for sure what I wanted to do, but I was pretty sure that it was not going to be working for a corporation, to be honest. Like I just knew that probably I would really be bad at trying to do sales, trying to do accounting. Like those are things that I just knew I would probably be terrible at, and I'd also be very unhappy. So I knew I wanted to do something which would help other people or make the world better in some way. And so when I graduated, I applied for some jobs in mostly nonprofit organizations, but it's really hilarious. Like I think I somewhere have like the resume and cover letter that I used way back then. And it is really bad, like incredibly, it wasn't terribly, like it's not terribly written. It was just not at all like in the right format or in the right terminology and all this. And so, yeah, it was really funny. So what happened is that after college, like I couldn't find a job right away. And I went to, I had gone abroad for a few months and then I had come back. I like went abroad, did my like my undergrad thesis on some work that I did abroad. And then I came back to the US and I was like applying for jobs, nothing worked out. And I had applied for graduate schools, but it was like on a whim. Like I hadn't taken the moment to think about it strategically, because like as an undergrad, I was one of those students who didn't use the Career Center and didn't really have the time to like sit down and plan. And so I had applied for graduate schools. And at the time I actually applied to several PhD programs in anthropology. And I did not get accepted to the ones that I wanted. And I got accepted to one. It was the University of Arizona, which is an incredible school for anthropology. But I was like, I've never even been to Arizona. I don't really know if this is right for me. I also was like, I don't think I want to necessarily be a professor like my parents, because the job market for professors is very difficult. So, and I knew that way back then. I was like, okay, I could work really hard, get my PhD, and then what will I end up doing? Maybe I won't become a professor. Like you have less than a 50% chance of getting a job as an actual professor. So I was like, and that was back then. Things are probably more difficult now. So anyway, I had applied on a whim to a master's program in nonprofit management at the New School in New York City. Completely just like, well, this won't take very long. I'll throw that in. I'm already applying for these other things. Let me throw in a master's program. What the heck? So I couldn't find a job after graduation. I had only applied to like 20 things. It's really very ironic, like what I now do, because I made every mistake you could probably make. But I had been accepted to the New School. And I was like, all right, I don't want to live with my parents, that's for sure. And I don't want to go work in retail. I don't want to be a camp counselor. You know, I'm not finding any really like jobs that fit with my interests. I guess I'm going to go to grad school. I'm good at school. Let me just do that. And I did. I moved to New York. And I never ever thought I was going to live in New York City. And I've been here almost the entire time since then. I took 4 years at one point to move to Washington State. But for most of that time, I was in New York City, and it worked out really well in the end. I got to have a lot more experience. I got several internships in grad school, and it kind of kicked things off and eventually got me to where I am. So it's weird because the master's in nonprofit management is not as obviously related to what I do as a career counselor, but I did have a certificate in organizational development, and that is a little bit more related because there's a lot about leadership and interpersonal, like organizational psychology and things like that. So it was, again, a fluke, and it's super ironic because I did all the things that you're not supposed to do when you're planning a career, which is like, well, let me just try this thing. Thing seems to have worked out. I'm just going to go there. There is something called the chaos theory of careers. I'm not an expert on it, but there's some books about this idea. And the idea is you may try really hard to plan your career, and there's an element of just happenstance that also gets in there. And it's, sometimes it wasn't entirely by chance that I had applied to that program at the new school, but it did happen to just kind of take me in that direction, and it's worked out. It's just really, but it is ironic that it was not like a thoughtful, intentional thing. It was just like, well, I guess I don't have too many choices. I'm going to keep going to grad school and hope it works out. So totally, tons of my students do that to this day. And I have tons of empathy for them because I did exactly the same thing, which is against all the things a career counselor would tell you. And that's how life is. People make those choices. It's good. It works out. It usually works out. So.
That is true. That is true. By happenstance, you ended up there. That's pretty amazing. That you just did it off of a whim and then decided.
Kind of, yes.
And it's also interesting that you got into the grade program at Arizona State and then decided not to go. But look at where you are now. You can only think back. So you said that you did have many experiences in undergrad, and then you got into this program, and you said you got to do a couple different internships. So tell me about those internships, or one of them that really stood out.
Yeah, so I got to do a couple internships in grad school. So thankfully, my master's program at the new school required you to do an internship, especially if you came in without any experience, which was totally me. Like I had lots of student leadership and a couple of like other stuff I did in undergrad, but I really didn't have like solid, real professional experience. So I did a couple internships. One of them was fundraising and grant writing at an environmental organization. And the other one was at a place called Support Center for Nonprofit Management. And I'm pretty sure they've changed their name or gone out of it. I can't remember now if they still exist actually, but that organization I stayed at for a whole year, and I got to do all kinds of really good things. I had a really great supervisor. It ended up being part of my master's thesis, which was like a marketing study for them, market research study. They were an organization that provides training and organizational development consulting to nonprofit organizations. So I was like, well, that kind of clicks off all the boxes, right? It's like I'm helping the world be a better place, and I'm actually doing something around training and improving programs. And I got to take all the workshops that they offered, which was great. So I learned all kinds of different practical skills from them. And so that was a really, really great experience. And I was there for a whole year. So it worked out really well. I did it part-time all through my second year. So part-time in summer, and then I just kind of continued on. Mm-hmm.
Yeah, that's a great experience, it sounds like. And you said you got a certificate in organizational development, and you also got a certificate in adult career planning and development at NYU. Yeah. Was this afterwards?
It was, yeah. So the story of that is, long story short, after grad school, I got a job doing fundraising at a nonprofit organization. And I learned pretty quickly, and I kind of knew this already. I was like, okay, this is not really for me. I knew that already, but I also was like, okay, I had trouble finding a job in the past after undergrad. I just want to make sure I get a real job after I finish grad school. I want to become a grown-up. I want to have an income and health insurance. I'm going to get a job. And the easiest job you can get in nonprofits is fundraising, at least at the time. And I'm sure it's really true today. Like if you can do grant writing, fundraising, you don't mind doing it, you will find employment. If you can reasonably do that work, you will find employment. So I did. And I right away knew, I was like, okay, this is just not this my thing. It's like, just there was a lot of administrative stuff. I was writing a lot of thank you notes to people, which I know are important, but I was like, really, this is not that exciting to me. By chance, not totally by chance, but I got help with, I was sort of in a transition time. Like I was there for a year and I was like, okay, this is not working. I need to find something else. And I started looking for jobs, and this will show you how old I am, but my mom what a wonderful person. She sent me an ad that she had clipped out of the New York Times paper New York Times. She still reads it, right? And she loves mailing me little things that she clipped out of the New York Times. So she sent me this job posting that was like, you know, an incredibly small, like one or two, you know, you couldn't, they used to charge a lot of money for these job postings. And so it was very short because it was paid, you know, per word or something, you'd have to pay for this ad. But it was at Brooklyn College, and it was having to do with raising money for internships at Brooklyn College, for like stipends for unpaid internships. And I was like, well, I know how to raise money. I guess I'll apply to that. What the heck? I applied for the job. I got the job. And it turned out that that job was partly like writing grant proposals, which I totally knew how to do, but it was also situated in the internship program. And while I was there, they were like, hey, why don't you go teach the internship workshop? Hey, why don't you help this student with their resume? And I was like, wait a second, I don't have qualifications to do that. Look at my own job search. I was a disaster. Are you kidding? Like, I don't mess up someone else's life by giving bad advice. So I went as quickly as I could, and I got this certificate at NYU in adult career planning and development because I needed to have the grounding to at least do a reasonable job with these career coaching type sessions for these undergrads. So I really got a lot out of that. And I also like read every book I could get on like resume writing and job searching and all of these things. So that's why I got that NYU certificate. So it was a couple of years after grad school, but I just, you know, needed to make sure I had the basics so that I didn't give somebody terrible advice in some way. And so that was helpful.
And was that the beginning of your career coaching journey?
It really was, right? That was when I started, and I was at Brooklyn College for 3 years. And I knew right away, I was like, okay, working with students, listening to them, encouraging them, brainstorming of different career ideas with them, helping them to market themselves to the employer, and providing education and development to these students. That is like a million times more fun for me than grant writing and all that other stuff. So forget about that other stuff. I still did the grant writing, but I was like, can I please do more of this coaching stuff? This is really much more fun for me. So that was absolutely when I started. I never left after that. Pretty much it's been a totally straight trajectory of career development, because what an amazing honor and privilege to be able to help someone in that difficult transition time. You are a student, you're trying to get a job to become a professional. You're worried and scared that no one will want to hire you. You know, the students at Brooklyn College, this is a CUNY school, City University of New York. 100% of those students were first-gen college. Almost all of them were working their way through school. Like, nobody had the privilege that I had growing up, where you had somebody who could help you with your whatever, with your search or getting through school. Nobody. They were basically just like striving. I mean, they had many of them did have supportive families and all that. I'm just saying that like they didn't have some of these like privileges that I had, for sure. So I was like, if I don't help these students, who's going to help these students? I got to hook these people up with every possible privilege I can give. So that was where I became very, very passionate about helping these students to achieve their goals. And it was just, I realized that, like, you know, I want to make the world a better place. This is one way I could do that. And it's also a way that lets me be creative, lets me be, you know, passionate and a caring listener and kind of a coach or counselor type. The other funny thing is that, you know, the resume writing and the grant writing had a lot in common. So even though they're totally different, the concept is I'm going to help you to show that you can do something really important. I'm going to put that in writing so that someone else gives you money. So, and I know, you know, from your other, you know, life is in philanthropy, right? Like, you know, if you can do a really compelling job of explaining, hey, you know what, I have these achievements, I've done these wonderful things, I have a track record, I have the commitment and the skills to do the thing that you need me to do. That's how you get hired. It's the same exact thing as getting a grant funded, is if you can do that exact same thing. So it was a fun, but it was a good transition. And I was like, oh, I can use these exact same kind of persuasive writing skills to help all these students to shine so that somebody grabs them and hires them. So it was a good, that was the kickoff for me is in working in higher ed.
Yeah, that makes a lot of sense. And I like that you highlight the transferability of the skills from grant writing to like career search and everything that goes into that. Because yeah, as you said, it is very similar and you do play off of those same skill sets and just understanding of what you have to apply in yourself to get there. Okay. So you also went through a Dale Carnegie training. So tell me a little bit about that.
Yeah, so that was a few years later. So I left Brooklyn College to work at Baruch College. And Baruch is also a CUNY school. And I would say that if any place kind of really, really trained me to be a good career coach and to run career services programs, it was absolutely Baruch also, because that unit was incredible. I had incredible colleagues. I had an amazing supervisor and very similar student population to Brooklyn College. The big difference is those students were business majors mostly. And Brooklyn College was a lot of arts and sciences and all different majors, but Baruch was like 75 or 80%, finance, accounting, marketing, human resources, stuff like that. And, between you and me, right, like that was not really, the majors were not that exciting. The employers that wanted to hire the students weren't really my thing either. They were mostly like accounting firms and investment banks, and not dissing these industries or anything, but they just weren't of great interest to me. But the students were amazing. And one of the things that my supervisor, Dr. Patricia Mbimbo, was her name. She's since retired, but she was an amazing, amazing leader. She had this idea, let's train some students in this Dale Carnegie training. And Dale Carnegie goes back till the 1930s. He wrote this famous book, How to Win Friends and Influence People, right? Some of you probably read that book. So there's a whole training program that goes along with it. It's like 12 weeks, 3 hours per week. And so what my boss decided was, let's get a group of the staff who work at Baruch College to be trained to teach Dale Carnegie training to the students. And what this training is about is both public speaking and interpersonal relationships and human engagement and kind of like conflict resolution. I'm kind of not explaining it quite that well, but it just does an amazing job of training people to be much more confident in public speaking. If there's one thing you get out of it, it's like you go from being an okay speaker to like an amazing, I don't know if everyone ended up like TED Talk level of public speaking, but it really boosts people's confidence because of the way it's designed and structured. So I did do the training of the trainer program, and then I actually got the honor of teaching a group of Dale Carnegie, like co-teaching a group, and I went on for a couple of other trainings. But yeah, it was a really, really great program, and I think it's really effective for just doing being better at interpersonal stuff and also building confidence. And it was really great for the students that I got to be helping out. So that was what that was about.
Okay, that seems like an awesome experience. And it's cool that they have like the trainer kind of model for that work. And yeah, I actually have that book on the ground right across next to me. And I definitely think it is like a lot about understanding the psychology of people and like building on the interpersonal skills of how to like just relate to people and have them feel good about themselves. And it's a great book. I recommend it to anyone because I think it's huge on like emotional intelligence as well, and just thinking through that as well. Mm-hmm. Awesome. And then so you then went on to get your EdM in adult learning and leadership at the Teachers College of Columbia University. So what was the thought process behind getting this degree?
Well, that's like yet a lot later on. And so here's what happened in between. So I was at Baruch College for 6.5 years. Then I found this opportunity to become a director of career services at the University of Washington School of Public Affairs, which is a policy school. And that was fantastic. And then I came back to New York and I found this opportunity at Columbia. And since I've been at Columbia, various mentors of mine at Columbia have encouraged me to go and get my doctorate, which is no joke. It is a big undertaking and a huge commitment. And I looked into different kinds of programs that would make sense for me. And the one that I thought I was going to do was an EdD, a Doctorate of Education at Teachers College in Adult Learning and Leadership. And so I eventually applied there and I started taking courses, and I really did get a lot out of that. I took a whole range of different courses on leadership, like lifelong learning kinds of programs. There was a lot of theory in these courses. And I was on my way, and basically the EdM was going to be, that was a Master's of Education. And it was kind of going to be something I did along the road towards the EdD. So that's why I even pursued that, really, is because eventually I was going to do the EdD. And then a strange thing happened. Again, talking about planned happenstance and chaos theory of careers. And that is that I was basically, I happened to, the long story short is that I was taking one of the courses at Teachers College, and it was about emotional intelligence, exactly the way one of the things you just mentioned. And I was loving this class. It was an amazing class. So you had to write a paper for your final project. And I decided to do, you had a couple choices. I chose this thing, a literature review and a paper. And so I did this lit review, and I decided that the subject was going to be emotional intelligence and the training of public health students, right? Like those two things combined. Is anybody training public health students to be emotionally intelligent? And if so, how are they doing that? So I did this lit review, and I looked and looked for every article, and I read all these articles, and I summarized the articles and all this. And one name kept coming up over and over again, Kasia Chabanowska, Professor Chabanowska from Maastricht University. Well, okay, it's by chance, this is so random, but like I had the opportunity when I first started at Columbia to go to France. This is a business trip. So this is like the fanciest business trip I ever got to go on. So I went to France to speak at the École des Hautes Études de Santé Publique, which is the French version, like the French public health school, the national public health school that they have. And I happened to by chance run into this person, Kasia Chabanowska, right? And then years go by. Then I went to Teachers College and I took this class on emotional intelligence. And I was like, Kasia Chabanowska, where do I know that name? Oh, I met her in France when I was there for like 3 days, 3 years ago. Really random. And then again, by chance, in March 2019, I attended a conference that was the Association of Schools and Programs of Public Health, ASPPH conference. Who was there but Kasia Chabanowska? I had kept running into her at different conferences because, it wasn't like I only met her in France. I kept meeting her at different conferences, APHA conference, ASPPH conference. I'd bump into her and say hi. We barely knew each other, but I'd just keep saying hi to her because we always showed up at the event that was about public health workforce or public health training or public health leadership, because I was always interested in those things. Well, there she is at this conference in March 2019. And I just have to say I had zero agenda, but I walked up to her and I did a completely fangirl thing, really like a total fan thing. And I just said, Kasia, it's so great to see you here today. I just wanted to let you know that I just did this literature review for this class on emotional intelligence. I've read all of your articles about emotional intelligence. I think one day I might want to do my doctoral thesis at Teachers College on emotional intelligence and public health training. And I just wanted to say that I think, I'm a big fan of all of your work. And she said, well, why don't you just be my student at Maastricht University? I have a PhD program. You could be my student. And I was like, really? Is that how this works? This is not how this works. Okay. Like this is where, again, I feel like, okay, it's partly because I took that opportunity. I saw her there and I was like, oh, I kind of want to say something because I've read all these articles. I'm excited about this topic. But so I had zero agenda, like I said, but but also like how much luck and privilege do you have to be invited to go be a PhD student or something? That just doesn't seem like it's supposed to be that way. Like that's not your normal admissions process, okay? But really bizarrely, it worked out. She invited me to be her student. Long story short, I said, you know what? I've done all these credits at Teachers College. I had like one more class left. I was meanwhile doing this PhD program. And I was like, I don't want to just be a dropout from Teachers College with 3 credits left. I'm just going to finish this, do my little master's thesis, and then I'm going to go finish my PhD. So that's what ended up happening, is that I ended up finishing that master's at Teachers College, even though I had already decided I wasn't going to go any further there, because I was already, so there was this weird window of time where it was like a master's student and also a doctoral student at the same time, while also writing a book. COVID. And it was not it was like a lot of really late nights. It worked out weirdly. It just worked out. So yeah, that's the story of that TC EDM. I know it's a long story, but that's what happened.
Okay, that's amazing. And that is like more recently, you said 2019.
Mm-hmm.
And this is the doctoral degree that you recently completed as well.
Yeah, so I started, now the PhD in Europe, if anyone in this audience, whoever listens to this podcast, if you're ever thinking about doing a PhD, don't write off Europe or other parts of the world, because their model is completely different from the United States. So here in the United States, if you want to get a PhD, you first have to apply and be admitted, of course. Then you usually have to take a whole bunch of graduate courses. Then you have to sit for a comprehensive exam. There might be a qualifying exam, then there's a comprehensive exam. Only then, which is like 3 years into your PhD, maybe 4, I don't even know, like years in, then you can say, okay, now I'm ready to start proposing the topic of my dissertation and start doing my own research for my dissertation. At least at my university, which was in the Netherlands, it's the opposite. It's like, if you have a master's degree, they think you're basically done with courses. And it's partly because in Europe, it's actually really difficult to get a master's degree. And so it's like a higher bar maybe than in the US. So basically they're like, okay, no more courses that you absolutely have to do. You have been admitted to the program. You have like 6 weeks to write your dissertation thesis proposal. You're like, from day one, you need to know what you're going to write about. And the other way it's opposite from the US is that in the US, you could be writing your dissertation and you get a lot of mentorship around it. You have a whole committee supporting you, but you're not really expected to publish something. It's like a nice extra if after you finish your PhD, maybe you then publish something from your dissertation. Maybe some people turn it into an actual book. Some people make it into a couple of published articles. In Europe, at my school, your dissertation is published research, which means that in order for you to defend your dissertation, you first have to publish. And at my school, it was a minimum of 4 first author peer-reviewed journal articles in what's called an impact factor journal, meaning a journal that is not, it can't be like there's a lot of academic journals that are not as well regarded, that might be predatory journals or not as great. So it has to be a real journal, basically. And I ended up doing 5. Actually, that's not even true. Was it 6? Anyways, I can't even, I'm just beyond 5. Anyway, so it was a lot of publishing. And I did get support for sure, but it wasn't, super intensive. My supervisor, Kasia Chibanowska, was incredible. I also got a couple of other co-supervisors, Linda Cushman at Columbia, who's a dear friend, and then JP Leiter. JP Leiter is like the world's biggest public health workforce expert and a great friend and mentor. And so anyway, they kind of helped me out with this dissertation. So basically, that's what ended up happening. It was, the topic that I came up with eventually, it ended up not being emotional intelligence, because that's actually really difficult to measure, and not necessarily, but like it's complicated. Like it would have been really convoluted. Plus, I'm not a psychologist, so it would have been like a lot of learning to try to measure that. So it was employment outcomes of public health graduates, and job market demand for the graduates. So it ended up being, it actually was six different articles. 5 of them were research articles and 1 was a policy article, but it was the upshot of that dissertation is all about public health workforce. And it's all about, we have these amazing students that are passionate and studying public health. And we have a government public health workforce that has been decimated because it has been underfunded for decades. It has lost huge numbers of the staff. These local health departments in counties and cities and tribal governments around the country and the state governments, they cannot even often provide the most basic things that they need to be able to do to keep people surviving, to prevent huge problems. They just can't keep up. And then COVID came along on top of that. So they were already not in a great place. And then COVID came along and now there's all kinds of other problems. And guess what? Our public health graduates are not finding jobs in government. There's a disconnect. And so that's what my dissertation was all about. It's not that there's not any, but it's like a small minority of the graduates who study public health who end up going into government. And it's not a total disconnect, but it's like a lot of work could be done to bridge the schools and the government agencies that need these graduates. And so anyway, long story short, that was my dissertation.
Okay, that's awesome. And that's definitely very important information. I'm actually on a task force right now in North Carolina thinking about local public health, and workforce is one of those topics that is coming up. And we are seeing that exact same challenge. And people have mentioned many a times that people would come into non-government organizations and work with as a fellowship, and then 6 months into their jobs, they'll hear back from the government saying that, oh, okay, you can come forward for this interview, whatever the case might be. And that's just one of the barriers that they are there. Okay, awesome. All right, so I'm gonna take you back a little bit here. So you got your EdM in adult learning, and you said you were working with public health students at that time?
Yes. Mm-hmm.
So when did you develop the want to go into public health specifically? Like when did that come up for you?
Honestly, I had been doing higher ed career services for my entire career. And up until the job I had at the University of Washington in Seattle, I was working with just a broad range of different majors, mostly undergrads. But when I got that job at the University of Washington, I got to work with Master of Public Administration students. And, there's pros and cons of everything. I absolutely loved my students at CUNY, and I kind of have a lot of nostalgia for my CUNY students because they were so awesome. But there's also something about working with graduate students, partly because they're a little more focused, a little more clear on what they want, a little bit more mature, depending on who they are. Like there's some different life experience they might have had. And it was also special because these grads were focused on public service 100%. They all wanted to work for either government or nonprofits or some kind of corporate social responsibility or something along those lines. That was their 100% of them. And so when it was time for us to move from Seattle back to New York for various family reasons and stuff, I was looking for different jobs in New York. And, it was actually very difficult to, there's just not very many jobs as a career services director, especially director level. And even fewer of those are going to be in a graduate school working with, public service related students. So basically it took me a while to find the right thing. And I just lucked out that the person before me at Columbia retired, right? And this job opened up and I was like, I'm going to have to apply for that because clearly this is all the good things. This is, public service related. The people who study this stuff are clearly wanting to make the world better. It's also grad school. And I just lucked out that I managed to land that job and been there ever since. So weirdly, my PhD is in public health. And I don't have an MPH, and I've never worked in a government health department. I've only worked in higher ed, but it's been public health higher ed now for the last 8 years or whatever. So So it's kind of awkward because on the one hand, I'm like, well, I don't know if I really count as a public health professional. Again, you know, like even though I've got my PhD in public health, I'm like, that's kind of weird, right? It should have been like organizational development or human resources, but it turned out that it's public health. But then again, you know, number 8 of the 10 essential public health services is workforce. And so guess what? I count as at least one of the 8 services, right? At some point, and I shouldn't say this out loud because I don't want to, you know, like set myself up for something, but like there's part of me that's like, I kind of need to buckle down and at least take an epidemiology class, for goodness sakes. I got a PhD in public health. I haven't even taken an epi class. Are you kidding? So there's part of me that's like, well, I did take stats. I did take 2 stats classes. I know how to do qual to some extent, the research methods, you know, but there's part of me that's like, I kind of ought to go back and do some more school so I actually can say that I've studied public health. It's like, my other degrees are all like nonprofit management, organizational development, adult learning. It's not unrelated, but it's also not public health. So there's part of me that's like, got a weird, I don't really worry about it much, but I'm like, do I really count though as a public health person? Like kind of. I'm a public health fanatic. Let's put it that way. I'm like a public health fan. I've gotten very, very passionate about it, even though I haven't like worked in the local health department. Anyway.
Yeah. Thank you for that, and that's awesome. And I think that you're definitely a public health professional. You've done a lot.
Thank you.
You're most welcome. You're most welcome. You've done a lot of great work and are doing a lot of great work to help people, especially with your book and I'm guessing with your career coaching and all of that kind of stuff as well. So when you started at Columbia, you also worked at a couple other jobs, correct? Or in other roles?
Yeah. So basically, I went from Baruch to the University of Washington. Then I came back to New York, and I had this short period where I was working as a recruiter at a nonprofit organization. It was actually the ACLU, which was totally amazing, I have to say, because I really like their mission. Most of the time, I really agree with them, but they have lots of different opinions. But surrounded by super passionate people, like they're incredibly mission driven. And it was good to have that experience as a recruiter, but it was also similar to like the fundraising experience where I was like, well, I'm glad I'm getting this experience, but this is definitely not my thing. It was a little more administrative than I was wanting to do, at least the role that I had, but it was a good learning experience. And then again, you know, this thing opened up at Columbia and I was like, I'm going to really have to just apply to that. Like, I can't not apply to that because I know this opportunity will never come back. Like this is a once in a life. It was one of those moments where I was like, this seems like a once in a lifetime thing. So, and I've been there since. Yeah.
Okay. And you've always been the assistant dean and director of career services?
I actually started out as the director of career services, and then I was privileged to get a promotion a couple years in. So yeah, that's where I've been in that dean role.
Okay, awesome. And what kind of things do you do in this role?
That's a good question. So it's a very mixed potpourri of things, which makes it fun. So I still do a lot of one-on-one work with students and also alumni. And what that looks like is the person, very commonly, person comes in and they just want a resume review. And so I'll go through and I'll edit that resume and make sure that it looks, you know, pretty and that it speaks to the job description they're aiming for and that it makes them shine. Like I shine that up so that it highlights their achievements, their outcomes, their results, and uses all the buzzwords for the job that they want. And, you know, even though I think at least at one point I tried to estimate how many resumes I probably reviewed in the last 20 something years, not even counting being a recruiter and reading all the resumes. It's got to be like at least 10,000 resumes. I'm just guessing. I don't know. But even though, I mean, you'd think I would be tired of it. Every single one is different. Every single student has their own story. They all have their own challenge. And you know, almost every time I feel a very nice moment where I'm working with that student where I can help them. You know, the majority of the students don't have as much confidence in themselves. They're just at the beginning of their career or whatever. We have international students who are new to the United States. And so, there's just a huge amount that they're absorbing and learning and growing, and just every other type of student that has different backgrounds. And I can always find something to help them feel a little more encouraged, a little bit more confident in their abilities. And often too, I can help them figure out where they might fit. And so there's a lot of coaching and kind of, I wouldn't say counseling because I'm not a licensed counselor, but I would say there is a counseling type of experience where I'm like listening, asking questions, following up. So there's a lot of that. There's also all this other stuff. So there's program planning, there's program evaluation. I get to kind of set a strategy for the office. There's supervising my team, who I'm very lucky to have an awesome team who are all, really passionate about this work. There's collaborating with other people around different offices or different departments. There's employer outreach, which is also super fun because these employers are really cool. I mean, we're talking to the CDC. I get to talk to folks at UNICEF. I get to talk to people at philanthropies, nonprofits, all of these different, New York City Health Department, they're awesome. So I get to talk to these folks and build relationships and connect them to these talented students. So it's a lot of like listening. There's a lot of teaching. I teach a lot of workshops. I'm also teaching I'm teaching classes now. And then there's like, writing reports. I still like writing, so I do a lot of that. Now I'm serving on some national committees also, that just because of all the other stuff that I've been up to. So it's really nice. It's just a mix of different things.
That definitely does sound like a mixed bag, and probably keeps you entertained and keeps on changing every day, which is good when it's a dynamic work like that.
Yeah.
So you said you looked over 10,000 resumes. What are some basic resume pointers that you typically have to give to people?
Yeah. Okay. Let's start out with spell hippo with 2 A's. I'm just the public health folks. It's just really funny to me. Like, you would be amazed. Like 50% of people, even very highly educated folks, will say the 2 P's instead of the 2 A's. I'm just joking, but that's like a classic. So spell check it. It's basic stuff. Always spell check, grammar check. Make sure, this is the most basic stuff. I'm going to start with the absolute most basic stuff. Make sure that your contact information is correct, that if somebody calls you to schedule an interview, that you actually will get that message, that you will reply to that message, that you're not going to miss your emails. Like, this is sort of ridiculous, but it's like the most important thing, because the purpose of the resume is to get you interviews. It's not to get you a job, it's to get you called for an interview, because you're almost never hired without an interview. So you have to be able to get contacted. It sounds basic, but you'd be surprised. Occasionally there's something where somebody put a typo in their own phone number. That's like the worst possible thing that you could do. So make sure that is correct. Design it so it's not over the top. I've seen some strange things. Let me just say, strange things in resumes. You don't want to go overboard unless you're going to go into like graphic design, something like that. There was this trend for about 5 seconds where people were doing infographics on their resume. The infographic resume was cool for about a minute. Unless you're doing something really fancy graphics wise or really, really creative, I would keep it more not plain. It doesn't have to be boring looking, but it doesn't have to have, a logo. It shouldn't, in the United States, for most jobs, you're not going to put your photograph. There's always exceptions to every rule, right? But like mostly we just have your name, your contact information, and then we get into the content, right? So you have, some people will have a summary section. That's not necessary for everybody, but if you're a career changer or you have a long gap of employment where you were, I would call this, let's say, a gap of paid employment, maybe you had for whatever reasons, you may want to have a section at the top which lets you market yourself in a way that makes sense for your target audience and maybe allows you to set the stage so that the person reading it doesn't get distracted by the fact that you're doing this big career change or whatever. Anyway, you can have a summary section. That's really difficult to write, but you can find good resume examples out there. And sometimes somebody's LinkedIn summary or the about section on LinkedIn gives you kind of an idea what that could look like. Then you either start with education or you have experience. So education, if you're a new grad, would usually go at the top. You get into everything in reverse chronological order. There's other flavors of resumes. I'm just talking about the most common flavor version is like, so everything within each category goes backwards in time. So if you just got your MPH, that goes first, then you put your bachelor's degree underneath, whatever, you go back in time. And I get all these questions. Should I put my GPA? Do I do this, do that? There's a lot of different things that are a matter of opinion or a matter of the situation or the context. So even I always get the question, like, is it okay to have a 2-page resume? What about it? Should it be 1 page? And I'm like, it depends. That's why I have a fun job, because I don't have to say yes or no to everything. It always, the answer is, it depends. It annoys everybody. Everyone is like, tell me what to do. I'm like, well, but it depends. If you're applying to the federal government, you need a really long resume. They want every detail going back to high school. They want to know everything you've ever done. If you're applying to a consulting company, maybe especially a more corporate type consulting company, you're applying to work for an elected official in DC or something, you need a 1-pager. They don't want to read more than one, it's got to be short and to the point. Nonprofits, NGOs, maybe academia, if you can substantiate 2 pages, then great. If it's 1 page of awesome content and then 2nd page of like every single volunteer experience you've ever had and like student leadership, and it's taking up an entire 2nd page, that's awesome for you. But, I would say, well, maybe, if somebody has like 1 or 2 years of experience, I'd say you probably get away with 1 page. You should probably not go totally overboard. But there's exceptions to every rule, right? Anyway, you have education, you have your degrees. You can put relevant courses if you really want. And then you get into your experience section, and you can have other sections. I like to have a skills section with your computer skills and other languages that you might speak. The really good part or creative part is actually when you're describing your experience. That's where there's room for a little more creativity, and this is where the 2 principles of resume writing, the 2 things, I say this to every single resume review client, almost every single person. There's 2 things to remember about resumes. Thing number 1, use the words from the job description. So that means you kind of have to start by figuring out what job you want. It's hard to write a resume without even knowing at all. You have to have at least a flavor, a clue, like read about 5 job descriptions and pick a couple that look like maybe they'd be interesting, and look for words that keep getting repeated and sort of sprinkle those if within reason. Obviously, you can't put something on your resume that you haven't done or something. But when I worked with a student, especially like a 1st-year student, and they're like, what do I need to do to get to be able to find employment when I graduate? I'm like, well, let's read some job descriptions. Go look at the skills that they keep asking for. If every job description says you have to code in SAS or R or Python or whatever, guess what? Between now and graduation, you need to go learn SAS, R, and Python. Go do that right now. Like, go put that on your list. Go take some classes. I want that on your resume before graduation. I don't want you to wake up the day after graduation and say, oh gosh, shucks, I should have learned R. Now I have to do that before I can get a job. So you sprinkle the resume with those words as much as you can. If you don't have the right words, you got to earn those words some way or another through classes, volunteering, something. The other thing, thing number 2, try to quantify your achievements. And I will just say, or qualify your achievements. What you're trying to do is to show that you did a good job. And you might ask yourself, well, I'm in public health. It's going to take 10 years to know whether my program actually made anybody quit smoking or whatever, right? Like, that's really tough to measure. So you can't always measure the final outcomes, but you might measure the outputs. I don't know if you ever took program planning and evaluation class, but they make you do things like logic models. You have to measure outputs, and so those of you who haven't taken that class, what you're doing is at least measure how many people showed up to your smoking cessation workshop, if that's your thing, right? Like, did you increase the number of people who attended? How did you do that? Did you partner with community organizations and build relationships so that they sent more people to your program? If you can start to look at that and say, well, when I started, we only had 30 people at our workshops. By the time I left, it was 60 people. And that's because I built 5 new connections with community organizations. and I marketed these programs and I explained why they're so important. And I used my enthusiasm to get people excited about it. So then instead of just saying, provided smoking cessation program, you would have, double the number of attendees in smoking cessation program, resulting in X% increase in successful tobacco cessation or quitting or whatever it is, or established 5 new partnerships with local community-based organizations and faith-based organizations, doubling the number of participants in the program. Yeah, I mean, this is the way I would go. And so it's tough because it's hard for people to reflect on how they made a difference. But if you look back on it and you keep track of like, how many people did you talk to? How much data did you analyze? What was the outcome of that report that you wrote? You wrote a report. Is it published on a website? Was it sent to the city council? Was it used as a talking point for an advocacy campaign, which then resulted in your legislation being passed or whatever? Like, these are all the things to think about. I could go on and on, but I think that's the 10-minute how to write a resume pitch. Hopefully it helps everybody. I hope so. I'm sure there's something I forgot. I always forget something, but those are the key things.
Yeah, thank you for sharing that thorough overview. I think that definitely highlights a lot of the key points that people need to have in their resumes. And like to the point that you were saying towards the end there, I think a lot of people downplay the things that they have done in their career or during school and things like that. That's why I always advise people to like talk it out to someone else who's probably in a similar position looking for jobs, because they can say, oh, but you did this, and connect those things that you aren't connecting for yourself, which I think is also very important. Okay, yeah. So another question here. So you said you do a lot of career coaching with students. What are some questions that for someone to like internally or introspectively just reflect to come out of a career coaching type setting better off? Or what are some of those questions that someone should ask themselves?
Yeah, that's a great question. So I use, this is mentioned in the book, The 101 Plus Careers in Public Health. That, thank you for showing. Thank you for being in the book. There is a section about choosing a public health career. And I use a model that I've been using for years, and I just sort of adjusted it for public health in particular. But I think of every career or job as having 3 ingredients. So you can imagine like the Venn diagram with 3 circles. And the 3 ingredients are, for a lot of people, it's the mission or the subject matter or maybe type of organization. And that's like, what drives you to work in public health? Are you passionate about maternal child health, and babies and new parents, for example? Are you passionate about a specific health condition? Maybe I've had students who were like, I want to work on sickle cell anemia. That's my thing. I'm like, okay, awesome. Let's hook you up with the people that work on that, health issue. There's specific, it could be much bigger picture. It could be, climate change and its impact on health. Health equity, huge. It kind of cuts through every single thing. So, what is it that is making you passionate about public health? And who's working on that? What organizations do you resonate with that do that thing that you care about? Now, some people are not necessarily driven by a very specific mission. And I guess I have even had students who are like, is it okay if I don't really have a specific mission in public health? And I'm like, yes, you're allowed not to have a specific mission, actually. Maybe you just want to make the world healthier, and that's it. You just don't have anything too specific. That's totally cool. That's great. Fine. If you are mission driven, sometimes your job search is simpler, because if you're like, I really care about sexual and reproductive health, and I also want to live in New York City, so here's the 5 to 10 places that I should look, right? It makes it more concrete. But it's also good to have an open mind and be open to different things. Then the second element in the second circle of the Venn diagram, right, is what do you actually want to do all day long? Like, what skills do you like to use? And what job function would you potentially like? And so for that, the questions I would have somebody leave a session with would be, when I reflect back on my favorite experiences, my favorite achievements, you know, a moment when I was working on some kind of project or activity that I felt like really I was involved so much that I like lost track of time. And I felt like I really just wanted to keep working on that thing. And this could be from a hobby, could be from work experience, volunteering, a class that you took, whatever. What were you doing at the time? Start to write that story down and reflect on it. And then look for, again, a theme. So those public health students, if anyone here has taken public health class, you might have taken qualitative research. You do thematic analysis, right? So you go through all your lived experiences that you felt like you were really engaged and like enjoying the actual activities. And you ask yourself, is it like every single time I felt really an achievement, it was because I was creating a new idea, or because I got to implement a program or a project and I made sure all the details were correct? Or was it I was talking to people, or I was writing, or I was coding some sort of computer software, whatever. And look for themes, and you'll start to say, you know what, I really, really like data analysis, and I don't have any stories where I was doing public speaking. So I'm going to look for a job doing data analysis. I'm looking for jobs where they ask you to do a whole lot of public speaking, because I don't think I would love those jobs as much. You know, you make a list of your favorite skills and your non-favorite skills. So actually looking at what you don't want to do. Some people have a very marketable skill, but they just don't want to use that for most of their jobs. Same with like my grant writing experience. Like I could do grant writing. Do I want to do that as my actual job? I probably not. Then the third element is lifestyle and values. And that's very important to know about. And it's things like, how much money will I get paid? Will I have work-life balance? Is there job security? Is there good health insurance? Does the culture of the organization feel inclusive for me? Do I feel like, is this a supportive, a culture that I like feel like I'm part of? Is it a good work environment? Do I like my boss? Do I like my coworkers and all this sort of stuff? So these are all things that sometimes, you know, people haven't had a whole lot of work experience and they don't realize the importance of these other elements. And they're just like, I don't care about anything else. I just want to make a difference for maternal child health. That's my thing. I don't care what. And I'm like, you know what? In a couple of years, you're going to come back and be like, you know what I said about how I only care about the mission? I just discovered that it also matters if my boss is nice to me, because I'm in a boss situation. It's not the greatest combo. Or I really need to make some more money at this time. And so I'm looking for a way to do that. So that element is also really important. And so what you're looking for is ideally a combination of these three things. What you'll discover is sometimes you luck out and you manage to get all three. You get your lifestyle things, you get your work experience, like favorite skills, and you get to contribute to the mission. Sometimes you have to prioritize and have to make choices. Like, you know, you may run into situations where, you know, you might just encounter having to make a tough choice. Maybe it's a choice between, I'm going to sacrifice my income a little bit in the short run because I want to just get some amazing experience. And there's this incredible nonprofit. Not that all nonprofits don't pay enough, they pay really well many times, but maybe there's one that is really, really resonating with your mission. And the salary is not incredible, but it's an amazing place to get yourself started. And so it helps you launch your career. So, you know, you might have to compromise one thing or another, maybe in the short run, but keeping your eye on that prize that eventually I'm going to get all the things that I want, hopefully. So that's kind of the model. So leaving the session, like, what do I love to do? How do I want to make the world a better place? And what do I need in order to thrive for myself? Those are the three questions.
Okay, that is awesome. Thank you once again for sharing some great, valuable information that I think everyone can get value and take some insights from, because that was really great. It was very thoughtful, and I like that model. And everyone should check out the book if they have not. It is linked in the description if anyone is interested in that. So another question I wanted to ask. So while you're working at Columbia, you decided to pursue your PhD in public health. And then you were also writing this book, 101 Careers in Public Health. How did you balance that? How did you find time to write the book as well as write your dissertation and do your job?
So yeah, that's definitely a good question. So weirdly, for some of the time, so like I took on this commitment to the PhD in March 2019. That's when I got basically invited to go there. And then in like October 2019, Beth Seltzer, the original author of the book and also the publisher of the book, reached out to me and they're like, we're looking for somebody to help Beth with revising this book because she's really busy. She's the doctor she's a public health physician at the New York City Health Department. She's got a lot of stuff on her plate. And, you know, she wrote the first 2 editions and she wants someone to co-author for the third edition. And I was like, well, you know, I really don't want to say no to this because it really speaks to me. And it's like my favorite topic right now. But I have to tell you, I'm doing my PhD. I don't know. I just want to be honest that like, I'll do my best and everything. And they were like, it's fine. You'll have a whole year to write it. You know, we'll give you a little time to do it. And then I was like, all right, no worries. It's just an update. You know, I'm not having to write this whole book from scratch. I had already written a book back when I was at the University of Washington. And so I'm not scared about the actual writing, weirdly, but just the time commitment. But I was like, well, you know, it's probably just a little refreshing, this little thing here and there. And then COVID happened. And okay, actually, we're going to have to rewrite this whole book because every single career in the book was totally changed from COVID. Every single person who previously, no matter what their job was, and this might be true in other fields too, but especially in public health, these were folks were like, the public health nurse that we interviewed who is in Alaska, she had been working on tuberculosis for Native Alaskan and Inuit, you know, communities in remote parts of Alaska. All of a sudden she's doing contact tracing for COVID instead. And it's really hard. I mean, she's like not wanting to have anybody kind of relapse with TB. It's horrific, right? And yet you have all this whole other stuff. So now she's having to do that. Every person had some story like that. And so we had to redo the book to incorporate. The other thing is that we had to incorporate, I made it my personal mission that I was going to revamp the book from a health equity perspective, that there were certain things in the book that I was going to get rid of. Like there were going to be no gender pronouns anymore, unless you absolutely had to have a gender pronoun. I was like, we're not going to do any of those. We're just going to make everything they from now on. And I also got like the part that was weirdly easy for me, the easiest part was like, let me find some new faces to be in the book, Omari. I was speaking of one, I was like, I want this book to reflect the vibrancy and the diversity of all of the public health workforce. So I looked for every possible person I could find from different backgrounds, especially people who were like maybe a little bit newer in their career or mid-career. And I went in and I was like, we wanted to revamp the profiles. And I have a lot of contacts on LinkedIn. I know a whole lot of public health people. And I was like, let me just do like a what do you call that? It's the hive mind or the crowdsourcing. I was like posting on LinkedIn. I need a public health nurse. I think I need a contact tracer. Can anyone tell me of another epidemiologist? I know tons of epidemiologists. Like, who do I find that does this thing? Some of them were hard to find. But anyway, how did I manage that while also going to do my PhD? I will actually answer your question. I know I went down a tangent, but how did I manage all that? It's hard to say, weirdly. I think I had a lot less sleep. I worked a lot of hours, but I also basically, in a weird way, because of COVID, I was not going into the office. I saved an hour a day of commuting time. I stopped all the ridiculous stuff that I was doing that wasted time, like no more Candy Crush on my phone or something like that. I was just going to focus on the projects. I work pretty well under a deadline. So working on the book was, that had a clear deadline. The PhD kind of had a deadline, but not in the same way. The other thing that helped me with the PhD, to be really honest, is that of the journal articles, like I had to publish in journals, right? And so, before COVID, it might have been more difficult to publish articles about the public health workforce, which was my subject, right? But because of COVID, there were a couple of special issues. Actually, there was only one article that came out in a special issue of a journal, but it helped because suddenly people wanted to hear about the public health workforce and, competition to hire public health grads and other topics that maybe before COVID, it would have been harder to get them published. Maybe they would have gotten published, but it would have been more rejections along the way or something. So I kind of lucked out. I had a lot of support. A lot, like the articles that I published, some of them I would say that, I just had a huge amount of help with them. They were all somewhat of a team effort to some extent, some more than others. The statistics parts of all the articles, I had amazing public health grad students at Columbia help me out with a couple of the statistics projects, because like only one of these 5 articles did I do my own statistics, and it was like a 2-sample t-test. I'm like, okay, I can do it. I'm not doing multivariable regression. I didn't even know how to do that. Thank goodness somebody helped me with that. Like I could do the really basic baby stuff. It was hard, but it somehow worked out. I would never do it again, that's for sure. Like maybe neither of these things will happen again. But I was also passionate about COVID because of COVID. Like I felt like I had to do these things. Like these stories had to come out. The stories in the book had to be told. This book needed to come out, and it needed to come out when it did, right? Like it couldn't wait another second, right? Like I couldn't not let that come out because there's no other book in print in the United States on this exact topic. There's a couple that are out of print. And the previous edition was really good, but it was 5 years old and it didn't have, there's a lot of stuff that was missing. So how did I do that? A lot of like sleep deprivation. But it was okay. I would not do it again if I could.
Absolutely fair enough. And kudos to you for getting all those things on, because I know that was not easy and you definitely pushed through. So kudos to you on getting all of that done.
Thank you.
Yeah. So going back to your dissertation for a bit here, are there any recommendations or things to improve around employment outcomes and employee demand?
Yeah, the upshot of the dissertation is that we have a lot of people studying public health. The enrollment in public health schools has gone up dramatically. There's a lot of undergraduates studying public health. And on the opposite side here, you have so many, in terms of who can hire them, you have, the degrees in public health historically, if you go back in history, they were designed to prepare people to work in the government health departments. That was the reason they exist. But these days, an epidemiology grad can get a really cool job at Fitbit. You know what I'm saying? Like Google doing data analytics, data science, health education students can get a really cool job at a healthcare marketing company making ads for Lipitor or something like that. There's just kind of a lot of employers that want certainly all the quant skills that an epidemiology student or a biostat student can get. Like they can get jobs in a lot of places. Pharmaceutical companies are really, really happy to hire these grads. Consulting companies want to hire these grads. Forget like even just the nonprofit sector and philanthropy and higher education, universities, research institutions, health insurance companies. They all want to hire public health grads because the skills are totally awesome. You've got, really good research skills. You have solid communication skills. You got some leadership skills in there. You understand about equity and diversity and justice. Just in general, when you look at who's hiring, if you look at like the fastest growing sectors of employment in the United States, and if you look at the fastest growing occupations in the United States, anything health related has been growing for like a long time. There's been a lot of jobs, anything health related at all has been growing. And anything data and statistics related has been growing. Like statistician, last time I looked at it, was like number 8 of the fastest growing occupations in the United States. It might have even moved up since then. So it's very much in demand. So what you have is this equation is you have a huge supply of these students, right, with amazing skills. But you meanwhile have this government public health workforce, like I said at the beginning, who's been just kind of gutted. I guess that's a terrible word to use, but like really so under-resourced. And it's not to say like I'm happy when anybody gets any job, basically. Like I'm delighted to when anybody gets a job, but I'm also thinking like, is the university that produces these public health grads, are they really fulfilling their mission if none of these public health grads go to work in the core backbone of our public health infrastructure, and none of them go work in a local health department or a state health department? And if they don't, what went wrong there? Is it because the public health actual training does not match what these health departments actually need? Is it on the government side, like you mentioned, that the government agencies have 100 barriers to hiring people? Like they have a civil service process that takes forever, and they don't have anybody in their entire staff whose job is really to do recruitment, and they don't have any training to do recruitment because they haven't had money to hire anyone in a long time. Like they can't even begin to compete with a consulting company that has $1 million to spend on their employer outreach and marketing and recruitment and all that. So, so there's this disconnect on both sides. And so the upshot of it is, I would like, if I could write like the future of what I would like to see happen based on my research anyway, I think there should be loan repayment for public health graduates who work in a government agency. The end. What's funny is that, do you remember the Affordable Care Act? Remember back then, was it whatever year that was? The Affordable Care Act. Guess what is written into the Affordable Care Act? There is a section of this 900-page document which says there will be public health loan repayment for students who studied public health and work in government. It's right in the regulations, and it was never funded. Never funded. There's loan repayment for doctors, nurses, social workers, physician assistants, PhDs who go study and do things that get funded by the NIH. Everybody has loan repayment, not everybody, but lots of people, teachers have loan repayment, not just loan forgiveness, not just public service loan forgiveness, but specifically loan repayment when you go and work in government exists for all these other folks and not for public health graduates. And like that needs to change right now. Like that needs to be changed. There's discussions of that changing. I recommend everybody call your elected official and talk to them, because there's a Senate bill right now, and there's also a House bill talking about loan repayment for public health students. So if anything, that needs to be fixed. And then secondly, there has to be permanent increases in funding for these health departments. The Biden administration has this money, which is going out, which is amazing and game-changing and awesome, but it's kind of temporary. And when you have temporary funding, you can't hire permanent people with that. So I think there needs to be like long-term permanent investments that are not up to the whims of different governments and elected officials, but instead are like, everybody has to spend this amount on this number of, if you have this population, then you need this many people in your health department. And that should be like a rule. I think that's complicated, but that's a thing. Fixing the hiring process for government, that's another incredibly difficult thing, because it's kind of like very set in stone. And then, the other thing is that nobody's even researching this whole workforce. Like there hasn't even been there are associations like the Association of State and Territorial Health Officials and the National Association of County and City Health Officials that have done like a basic kind of assessment of how many human beings actually work in local and county health departments and how many people actually work in the state government health departments. But there hasn't been like a totally rigorous kind of head count of people since 2014, because nobody's funded research on the government health workforce. So there needs to be some research on the workforce, and there's just so much work to be done. I'd like to be optimistic that, there's at least some motion to fixing these issues, because it's not new. It's just gotten way more difficult because of COVID. But like, this is not a new thing, this disconnect where there's not enough people going into this field. So that's what I would love to see happen. The loan repayment is my big issue. I really would love to see that happen for people, if possible.
Yeah, man, I definitely think it's possible. I think Biden, like a couple months back, passed some bill, but it was directed at doctors and nurses and getting their loans repaid. And it didn't say anything about public health people, even though we're in a public health pandemic. But yeah, I do hope that is also the case. And thank you for doing all that great research and that great work, because it's definitely important. And I think, as we said earlier, public health is in the limelight, and we're in a spot where we can do a lot of new and cool things, and hopefully just be more impactful and going forward. Okay. So 2 more questions before I move you on to the Furious 5. So you wrote 101 Careers in Public Health, as we just spoke about. Who is this book for?
Oh, yeah. I mean, this book, I would say, is open to anybody who would just like to explore public health careers. I think it would be especially good for a public health student, whether that's undergrad or grad, because we made sure to include like jobs that you can get in public health with no college degree, with just like on the job training or whatever. Jobs you can get with an associate's degree, jobs you can get with bachelor's degree. It goes all the way to like MD, PhD, and et cetera. So anybody who has an interest in it, I think hopefully would get something out of it.
Yeah, absolutely. And I enjoy reading it and hearing different people's stories and seeing what they do. And I think, like, if I knew about this resource during my MPH, it would have been hugely helpful. So I'm definitely grateful that public health students now have this updated resource with a lot of great information in it. And as I said earlier, it's linked in the show description and in the show notes if anyone's interested in checking it out.
Thanks.
You're most welcome. Okay, so before I move on to the Furious 5, I wanted to ask you, where do you see yourself in the future?
Yeah, I mean, it's a nice question. I think it's funny because I'm a career coach and like I should know the answer to this question. I would just say that I can imagine just continuing with what I'm up to and trying to push these different issues forward in whichever way that I can. And whether that is, I could certainly see like at Columbia, continuing with what I do, maybe doing a little bit more research work or some more teaching work. Also, I've also been involved with different, committees and organizations that are trying to move these things forward. And so, I can't say that like I will, I want to be part of a solution that helps fix, the challenge that we see with COVID in one way or another. I'd love to be part of that solution if I can. And I think it's a big project, and I think that it's complicated, and just getting more people to go work in a local health department is like part of it, right? There's a lot more complicated issues that are actually way more difficult even than that. But that's something that I could actually help with because I have some skills that like maybe would help with that situation. So regardless of what I end up doing, I think continuing on in this journey of trying to do something mission driven that helps contribute to public service and also has something to do with people's career and helping other people achieve their dreams in some way, that's what I see myself doing.
Awesome. We look forward to seeing how that unfolds for you. Thank you for sharing that. So moving on to the Furious 5, 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Yeah, establish some connections with others who share your passion. So don't be scared to do a little networking and build connections with alums, or others in your field. And don't be shy, like do the fangirl thing, the fan person thing, you know, like go up to somebody that you admire, and sometimes you have a tremendous luck where that person becomes your mentor. So don't be shy to try to do that.
Great advice. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
You have to love students to do what I do. You can't do this work if you are not absolutely passionate about helping students achieve their goals. You have many other jobs you could do if you don't love students. So number 1, you have to love students, whatever you do, if you want to work in kind of that university career services world, and to help people with the difficult transition from student to professional, or to student to like person who has their next step. That would be my main thing. There's a lot more I could say, but that would be in a nutshell. Mm-hmm.
Okay. Number 3, what's something you're working on improving in your life right now?
This is ironic, but I am working on taking time for family and my own health. So just getting back in shape. Like I think I have, you know how people gain weight. Like I think I've gained the COVID-19, like 19 pounds or something. That's not funny really, but you know, like I do want to go back to, you know, running and exercising and stuff like that. So that's something I'd like to improve for sure, and spending more time with family for sure.
Love that. Number 4, professionally, do you recommend anything outside of 101 plus careers in public health?
For sure. I mean, there's lots of other books out there. I am also working on some websites with other organizations that haven't yet launched. So when they do, I'll definitely let you know, and you can make a note to people or update the notes or something. But there's a resource which we are working on. I'm working with the Association of State and Territorial Health Officials and CDC Foundation, actually, to create a website that explains what public health careers really are, and has some videos of people in mostly in government public health, because it is mysterious. Most people don't know what an epidemiologist is. Even today they don't know what it is. So certainly they don't know what a public health nurse does. They certainly don't know what an environmental health specialist does. Like, these are all mysterious jobs to most people. So that resource will be out pretty soon. There's a couple of other websites that are also really good. There's This is Public Health. The This is Public Health website is part of the Association of the Association of Schools and Programs of Public Health, ASPPH. They have a nice website. LinkedIn, I'm not trying to sell anyone on LinkedIn, but it is a really good resource for networking. It's been really helpful for me. I also have another book that I wrote in 2010, and that's Jobs That Matter: Find a Stable, Fulfilling Career in Public Service. And that book is much more broad. It's about government, nonprofit, anything in public service, and it cuts across all different sectors. It has some things kind of weirdly in common with the 101 Plus Careers book, actually, but that's another resource to look into. So those are just a few things.
Okay, awesome. Well, thank you for sharing those. And yeah, if those websites do get updated and things like that, I will definitely love to get those links if that's possible.
Sure.
And then last but not least, where can people connect with you?
Oh, yeah. So like I was saying, LinkedIn is probably the right place because I'm on there all the time. I also am on Twitter. I would say that I follow a lot of public health people on Twitter, and, you know, virologists and epidemiologists and other scientists in there. So feel free to follow me on Twitter. My handles are just the same, Heather Krasna. So you could look for me there. Yeah, that's probably the best way to connect.
Awesome. Well, thank you so much for taking time to come on the show and share your insights and share your story. I definitely found it great, and got a lot of great information from it. So thank you.
Thank you so much. It was really an honor to be here. Thank you very much. And I look forward to staying in touch.
Yeah, we absolutely will. So some housekeeping items. Thank you everyone for watching. be sure to subscribe, watching or listening, sorry. Be sure to subscribe, be sure to leave a like, be sure to leave a review, and share it with a friend. And I will see you all next week.